Rachel said, Kudertels state that ADHD is commonly reported in NF1, with a prevalence estimate between 30 to 67%. Many children with NF1 have a very mixed bag of learning issues, but the cognitive behavioural phenotype of NF1 is characterised by specific learning difficulties, neuropsychological deficits, attention hyperactivity disorder, and social and emotional problems. In practice, we do find that children with NF1 struggle more with attention than hyperactivity, and this is supported by research by Hyman in 2006, who state that people with NF1 exhibit higher levels of inattention, particularly in tasks requiring sustained mental focus and effort, organisation and task completion.
So just to touch on neurofibromatosis type 1 and autistic spectrum. I'm sorry.
I haven't quite finished my bit yet, I'm just galloping ahead. Sorry about that. Researchers have also looked at whether there are any links between learning and behaviour in NF1 and unidentified bright objects, commonly called UBOs or T2 intensities, which are seen in the brain in MRI scans in children with NF1. Although there have been some reports that thalamic lesions may have links with lower attention scores, Hyman again said in their work in 2006 and 2007 that there were no links with cognitive deficits, and with many of these areas resolving by the age of 20. There have been other studies challenging this since, but none of the evidence has been particularly substantial. Medication does appear to help children with ADHD in the clinical setting and NF1, and research by Mountner showed that methylphenidate may be more effective in lower doses in those with ADHD and NF1 than those with ADHD alone.
My turn now. Just to touch on NF1 and autism, I'm sure that everybody in here is aware that it's a developmental disorder characterised by impairments in social interaction, social communication, along with restricted repetitive behaviours. And also research indicates, as has been mentioned before today, that there is a higher incidence in boys. So the link between NF1 and autism was first identified over 3 decades ago by a chap called Gilberg in 1984, and that kind of set the ball rolling a little bit. And in 2013, Shruti Garg, who is a psychiatrist from Manchester, worked on a piece of research that looked at the link in autism with NF1 as having about 25% prevalence. So that's a quarter of our patients that we deal with, and also that a further 20% will show some partial features of autistic spectrum disorder. So recently there has been considerable research interest into the genetic link between conditions, and more specifically the co-occurrence of autistic spectrum disorder and NF1. And this is because NF1 is a single gene disorder. So I know that Ruth earlier touched on the genetics, but just to reiterate, NF1 gene, the NF1 gene encodes for neurofibromin, which regulates cell differentiation, growth, and apoptosis, and this is via the RAS pathway. Neurofibromin plays an important role in synaptic plasticity, which is involved in memory and learning. So there's evidence that links abnormalities to the RAS pathway, links abnormalities in the RAS pathway with autism. And this is what makes NF1 a highly rewarding area of study in the context of autism. And animal models have actually started to show us that there is scope for therapeutic options to be tested in the future. Back in 1961, so we're talking 50 years ago, Lee et al. Actually explored the potential of using lovastatin in reversing the learning impairment in mice, which was quite an interesting study. And that's actually led on to Shruti Garg again, who is the psychiatrist from Manchester Hospitals, and her team have actually just recently completed the Santa trial, which is now close to publication. This brings the research from 1961 up to date. This trial involved 16 weeks, children aged 5 to 9, and they were investigated with the use of the drug simvastatin. And this was to reverse the cognitive phenotype of NF1 and autism spectrum disorder. They came in to Manchester. They were recruited from all over the country, and they were initially screened through a questionnaire to see whether they met the criteria for the study. And then they were given either simvastatin or a placebo. They were seen again 3 times over this period of 16 weeks, and they were actually given an MRI. And as I say, this study is close to publication now. It's a very interesting study. So this slide actually ties in with Dr. Young's presentation that she gave just before this about the comorbidities that can present, and we certainly do see this in NF1. So there are noticeable problems in NF1 which do affect several areas of functioning, and I'm talking here on the learning and behavioural level. So to understand the different cognitive and behavioural difficulties that these children have is absolutely essential to care, and also ongoing through life and through transition into adulthood as well. And Ruth and I work an awful lot in schools. We work with the teachers and we work with the SENCOs in trying to communicate these difficulties that these children with NF1 can have in terms of trying to advise about remedial approaches. Now, we were talking, and I know that Dr. Young was talking about the overlap between autistic spectrum and ADHD and other behavioural issues. And we do see diagnostic overshadowing, and there's no one universal cognitive profile of a child or adult with NF1. There's huge variability. I talked about the variability in terms of the health conditions, the health complications, but there's also huge variability in terms of the learning and the behavioural problems as well. Now, as Ruth said, 50% of children and adults with NF1 do meet the expected diagnostic criteria for ADHD. But the presence of ADHD symptoms in these children and adults do not fully explain the cognitive, behavioural and social difficulties that they have. This means that early screening is absolutely essential. Neuropsychological evaluation also absolutely essential. And it could be that, as mentioned before, autistic spectrum may be masked by ADHD, or in NF1 it's more ADD, attention deficit, and also vice versa. So it's really important to consider all of this because people with NF1 do have various cognitive impairments, but also to throw into that mix of ADD, ASD and all these other learning difficulties that were on that slide that I showed at the beginning. These people also have problems with disfigurement, which also causes problems with anxiety, low self-esteem, etc. So that's all thrown into the mix with all of this as well.